Hi, welcome to Working as a Sessional GP in the North East of England. This presentation is all about the sources of support which you can access. There are lots of challenges to working as a locum, from professional challenges around de-skilling, isolation and appraisal, clinical risk because of lack of familiarity, and business risk around getting work, sick leave, and also administrative challenges around sorting out all your paperwork, invoicing, fees, superannuation and tax. So it's really important to know where your support lies. The North East Sessional GP group has been around for about 20 years and it has over 400 members. It's run by volunteers who are elected annually, and those volunteers consist of a chair, a treasurer, secretary, webmaster and 3 supporting officers. The composition of the group is made up mainly of locum and salaried GPs, but it's got significant numbers of GPs who are partners, registrars, and also working in teaching, academia, and in other roles. So NESG does a variety of things for its members. It provides support with education through a monthly programme which includes safeguarding and CPR, and it also helps the creation of self-directed learning groups. Additionally, it cascades emails about events that are happening in the area. From a peer support point of view, there are opportunities to meet with members at the quarterly members meetings, but also at the monthly educational meetings. There's peer support through self-directed learning groups and also through the annual social event. And then the group also cascades emails about vacancies which are placed on the website by practices at no charge. And finally, there's lots of information provided via its web pages, newsletters, and also informally through the network. One important finding from a recent survey we did of NESG members is that being a member of NESG actually reduces your risk of leaving general practice. So 37% of respondents to our survey in 2015 said being a member had reduced their risk of leaving. One of the things NESG provides is a free advertising facility for practices. All they need to do is fill out a vacancy page on the website. This then gets approved by an NESG moderator, and that in turn results in a distribution of emails directly to NESG members who have signed up for these, and also being placed on a listings page. And if the vacancy is less than 7 days away, the email alert will go out very, very quickly indeed, but at the latest at the end of the day. And this service is entirely free to practices. So the other thing that NESG has done over the years is work with a variety of partners, both regionally, and that includes LMCs, GP training schemes and the Deanery, out-of-hours services, the regional BMA office and CCG's and pensions team at the area team, and also negotiated group deals with Hot Topics and GP Update. At a national level, we've been the focus of a case study by the GMC on the support we offered doctors to help get them through revalidation. We've been the focus of an RCGP revalidation pilot for sessional GPs, and also been used as the focus of a project by the Royal Medical Benevolent Fund on support for sessional GPs. We've also sent updates to the NESGP and been in contact through myself, Paula Wright, with the National Sessional GP Subcommittee of GPC, and finally informal contact with chairs of other sessional GP groups. And here's a report on the research done into support for sessional GPs, which looked also at factors for success in learning groups. This was a report of the revalidation pilot, which was funded by the RCGP and which NESG members were participants in. And the RCGP revalidation guide in 2014 acknowledged the input of NESGP through the guidance that was produced. And here's the GMC case study based on NESG and around revalidation. So I'd like to give you an overview of the opportunities for education in the North East. So as well as the programme provided by NESG and the facility to find learning groups, GP Choices Durham has a sessional programme of education, and most of the acute trusts also run a GP educational programme. There are the private trusts as well, the Nuffield and the Spire, and then there are specialty events like family planning days, dermatology club, palliative care days, and so on. And the Royal College local faculty also runs a First Five programme, plus there are private events like GP Forum, GP Update and Hot Topics, and finally the CCG protected learning time out events, which run throughout the region. And if you're a member of NESG, you'll get email alerts as each of these events are advertised. You can read more about the survey we did of NESG members and the effects of membership on retention in the BMJ careers of November 2016. Here are some quotes from some of the respondents. One of the really useful benefits of NESG is the facility to help you link up with colleagues to form a learning group. And learning groups are fantastic for peer support and for CPD. So learning groups help with CPD and peer support, but not only, they also help with benchmarking your clinical practice by discussion of cases, and they're an opportunity to discuss significant events, which is important for appraisal. They help with motivation and also allow an opportunity to discuss non-clinical topics. And they're also an opportunity to develop skills in teaching, facilitation and study methods. You can read a bit more about learning groups and their benefits in this BMJ Careers piece. One of the challenges of being a locum is that you don't have the sense of belonging to a team that you do when you're in a practice. So you might feel a little isolated when you decide to become a locum. But it's really important to remember that there are lots of opportunities to be part of a network when you work as a locum. So it might be through learning group or through NESG, and it might be through your other roles that you're pursuing a portfolio in. So it might be through your work as an appraiser, or your work through out-of-hours work or a federation. It might be through gypsy work or through undergraduate teaching. You might decide to join a local medical committee. And finally, there are some Facebook groups that you might want to join, such as GP Survival, Resilient GP, the National Association of Sessional GPs, and the Sessional GPs Northeast page on Facebook. One of the decisions you face when you decide to become a locum is what kind of locum you want to be. And there are 4 different models which you can choose from, each with benefits and disadvantages. So you could be freelance, work through an agency, work through chambers, or through a web-based platform. And the issues worth comparing are the degree to which you get admin support, peer support, educational support, help with appraisal, how much autonomy you get and control over your workload, whether you get a supported induction to each new practice, and how much you feel exposed, or whether there is a process for advocacy and protecting you. And it's beyond the scope of this presentation to go through the differences between these models, but I do have alternative videos on my YouTube channel that can explain the pitfalls and benefits of these different models. So how are locums obtaining work? Well, our latest locum survey shows that the majority are still getting work by direct approaches from practices or via NESG alerts, but an increasing number are using agencies or web-based platforms. This slide represents a new form of working called hub working. Here you see patients from a wide area at 15-minute appointments, and you have access to the full medical record. And this has advantages and disadvantages. So is hub working for you? Well, you might like the 15-minute appointments and the access to the full record. This also means that the indemnity is classed as scheduled care, so less expensive, and there are no paperwork, scripts or results to handle. However, there is no continuity, it can be isolating, and the IT isn't fully sorted out, and the hours can be slightly more antisocial, with shifts starting early in the morning or finishing later at night. What about options for working out of hours in the Northeast? Well, there are 2 main providers. There's Vocare, which now has the contract for Northern Doctors Urgent Care, and there is also the option of working for Gateshead CBC, which has an out of hours service called GatDoc. So the sources of advice and support for locums are quite varied, and we've covered some of them already. So peer support can come from NESG and learning groups, but also from Facebook groups and from the RCGP First 5. Support around terms and conditions might come from the BMA and the locum handbook, the NESGP, but also NESG templates and your LMC. We've described in detail the educational opportunities, and also appraisal support comes from either appraisers, deanery tutors, the appraisal lead, but also there's lots of information on the NESG appraisal page. The other source of support is Health Education England, or what we used to know as the Deanery, and this runs two important schemes for sessional GPs. One is the National GP Induction and Refresher Scheme, which is for GPs who've had a career break of 2 years or more, and the GP Retainer Scheme. So who are your sessional colleagues? Let me introduce you to some of them. Here are some sessional GPs with important national roles. Here are some local sessional colleagues. This is a Facebook group page for sessional GPs working in the North East. I hope you found this video helpful. If you enjoyed this presentation, you might wish to consider reading about the NESG surveys on the website or watching some of my other videos on my YouTube channel. Please also consider liking this video, sharing it, and subscribing to my channel. You can also follow me on Twitter. Thank you.